All right, so we're going to go ahead and get started. Again, I said this probably 7 times already, but thank you all so much for joining us this evening. Welcome to the 11th Annual Diabetes Seminar. I see some familiar names in the participant list and the attendee list, so hello. But for those of you who don't know me, my name is Alita Watkins, and I am with the Riverside Community Health Foundation. On behalf of the foundation, again, for the 8th time, I want to thank each of you for joining from the comfort of your home. So for those of you who may be unfamiliar with the Riverside Community Health Foundation, we are a nonprofit that provides free health education and physical activity classes to the cities of Riverside and Harupa Valley. Our mission is to improve the health and well-being of the community. So this year we celebrate our 11th year of the annual diabetes seminar. And I know some of you have been here since the beginning. So thank you for being such a loyal attendee for this event. We are really, truly happy to see that you have joined us tonight and really took the time out of your evening to spend with us. So if you're joining through your cell phone, I know sometimes it can be a little small, but what you can do to see the speaker, instead of seeing everybody else, you can either swipe left or swipe right, just to give you all a little direction, because on the computer, it's a little easier to see, but on the cell phone, it's a little smaller. So that you can either swipe left or swipe right to see the speaker. So let's get right into it. So diabetes affects all of us, and it's important for people to know that they are not alone on this journey. It's possible to live a happy, healthy life with diabetes, a life that you and your family can enjoy. So this year's seminar focuses on how to prevent long-term complications of diabetes like kidney disease and neuropathy, also known as nerve damage. And we have amazing experts that will present to you today. To ask the presenters questions, feel free to use the Q&A option at the bottom of your screen. It says Q&A and it has little chat boxes. So if you have, as they're presenting, and if you have a question, since webinar is a little different, just pop in your question in the Q&A box. That's the easiest option. And at the end, we will collect all of the questions and we'll have a quick 15-minute Q&A with the presenter. So that's for the Q&A portion. But if you have any tech issues, we actually are fortunate enough to have some tech support. So if you need some help, you can send a chat to tech support, or you can call 909-435-0715. Again, if you have any tech issues, like you can't hear, or we all got technical difficulties, so feel free to send a chat to tech support, and they will be sure to help you out as soon as they can. And this is the most exciting part. For those of you who this is not your first diabetes seminar, you all know that it's tradition for us to have an opportunity drawing at the end. So we're still going to keep that tradition. So at the end of the seminar, you will have the opportunity to win a prize. And that's something that you definitely don't want to miss, because that's exciting. Well, the whole thing is exciting, but I know people like prizes. Like myself, I like prizes. So that's the most exciting part for me. So again, I want to thank everybody who made this seminar possible, starting with the planning committee. Thank you all so much for your time and dedication in making this seminar possible. We would not have done all of this without you. So thank you all so much. I'd also like to thank the excellent speakers who will actually get to the heart of this seminar's topic, which is helping people to live happy and healthy lives with diabetes. And that is actually a topic that we can hold dear to our hearts. We also know the importance of preventing type 2 diabetes is why the Riverside Community Health Foundation offers the National Diabetes Prevention Program free of charge. So again, it's called the National Diabetes Prevention Program, or in short, NDPP. You might have heard us throw the acronym around here and there. But if you're interested in knowing more about this program, or if you'd like to sign up, please visit rchf.org, and that's our website, or click the link that is found in the chat section. I see that somebody just put it on there, so thank you for being so quick with it. And we would like to take a moment to congratulate the dedicated individuals who graduated during the year 2020, and those who are currently in this lifestyle change program, NDPP. And we all know 2020 was hard for all of us. So we really commend those who were the graduates of the year 2020. And we've also done it in the past before 2020, but we just wanted to spend some time to highlight those people who graduated in 2020 and the people who are currently in the NDPP program. For those of you who don't know, this is actually a year-long program, so that takes some dedication and determination and hard work. And the faces that you see on the screen are those who, like I said, worked hard and were determined, and they continue to prevent diabetes. Congratulations to all of you for being part of this amazing program. Once again, thank you and congratulations. So we'll get started in just a moment, and before we do, we would appreciate it if everyone would please fill out our 5-question survey so we can make the future diabetes seminars even better. Your feedback is actually very important to us. So if you're, and also another side note is if you are attending this seminar with friends and family members, so for example, if you're not able to do the poll, feel free to scan the QR code that you see on the screen. So that way you have your own survey to fill out. And that QR code will take you to the website, and then you can fill out the survey that way. So again, if you are by yourself on your computer or your phone, feel free to put it on the poll. And if you're not, you can either click the link for this survey that it was just in the chat, I believe I saw, or you can scan the QR code. So the pre-survey is up. So I'm going to go through the questions really quickly. So just answer to the best of your ability. And again, the purpose of this is just so we can get a gauge on how to better the seminars in the future. So question 1, on a scale from 1 to 5, with 5 being very knowledgeable, please rate your level of knowledge about the relationship between diabetes and kidney disease. 1 being not knowledgeable at all, 2 being very knowledgeable, 3 is neutral, 4 is somewhat knowledgeable, and 5 is very knowledgeable. So if you can answer that question. And again, all these questions are single choice. Number 2, on a scale from 1 to 5, with 5 being very knowledgeable, please rate your level of knowledge about preventing and managing diabetic kidney disease. It's on the same scale as before, so 1 through 5. 1, not knowledgeable at all, and 5, very knowledgeable. Oh, you guys are quick. Okay. I'm still going to go through the questions just in case some people need some extra guidance. Number 3, on a scale from 1 to 5, with 5 being very knowledgeable, please rate your level of knowledge about the relationship between diabetes and neuropathy. And again, like I mentioned before, neuropathy is also known as nerve damage. 4, please rate your level of knowledge about preventing and managing diabetic neuropathy. Number 5, please rate your level of motivation to incorporate the recommendations on how to prevent and manage diabetes. Awesome. So I'm gonna give you guys a couple minutes to answer that. And then once the pre-survey is done, we can get into the nitty-gritty of tonight, the main part. And if you're having any tech issues with the survey or you can't find it, please send a chat to tech support and they'll be able to troubleshoot that for you. All right, we're gonna give it maybe 1 more minute. Another option as well, if the poll is just not showing up on Zoom, you can also click the link as well. That's a little faster. Awesome. So we have 20 seconds. Okay, going once, going twice. I think that's it. Cool, awesome. All right, once again, for the 10th time, thank you all for joining us. Now it's time to introduce you to Miss Katie Nerio. So Katie Nerio is currently a clinical research assistant 1/health educator at the City of Hope Center of Community Alliance for Research and Education, for CCARE for short. She holds a bachelor's degree in public health under the Health Promotion and Disease Prevention track from California State University of Los Angeles. She is a certified health education specialist, CHES for short, and a certified group fitness instructor. Katie is fluent in both English and Spanish, and her work at CCARE focuses on coordinating various programs to help reduce the risk and burden of chronic illnesses, including cancer, obesity, and diabetes. She has gained valuable knowledge in the research environment and community health, which is why she enjoys improving the well-being of individuals, families, and children by providing resources, information, and support. Welcome, Ms. Katie Nerio. And whenever you're ready.
Hello, everyone. I'm going to go ahead and start by sharing my screen, so bear with me. So good evening. Hope everyone is doing great. Thank you so much for inviting me to be a speaker here today at the 11th Annual Diabetes Seminar. I'm really happy to be here. As mentioned, thank you for the introduction. My name is Katie. I'm a health educator at City of Hope, and today I will be covering kidney disease. So let's start with how your kidneys work. You have two kidneys, each about the size of an adult fist, located on either side of the spine, just below the rib cage. Although they are small, your kidneys perform many complex and vital functions that keep the rest of your body in balance. Your kidney pretty much filters all your blood in your body every 30 minutes. Kidneys have many functions and work real hard to remove waste and excess fluid, filter the blood, keeping some compounds while removing others, control the production of red blood cells, make vitamins that control growth, release hormones that help regulate blood pressure, red blood cells, and the amount of certain nutrients in your body, such as calcium and potassium. So now let's move forward to what is kidney disease. Kidneys that function properly are critical for maintaining good health. When people develop chronic kidney disease, the kidneys become damaged over time, may not clean the blood as well as healthy kidneys. If kidneys do not do the work well, toxic waste, extra fluid accumulates in the body and may lead to high blood pressure, heart disease, stroke, and early death. However, people with chronic kidney disease and people at risk for chronic kidney disease can take the steps to protect their kidneys with the help of their healthcare providers. Chronic kidney disease is actually very common among US adults. More than 1 in 7, about 15% of US adults are estimated to have chronic disease. What's alarming is that many as 9 out of 10 adults with chronic kidney disease do not know they have it. About 2 out of 5 with severe chronic disease don't know they have it. That's about 40% of people with severely reduced kidney function are not aware of having chronic kidney disease. With little to no sign of symptoms, it usually goes undiagnosed until it reaches later stages. Here are a few of the symptoms that you can be aware of. For example, if you're tired, have less energy, or have trouble concentrating, if you're having trouble sleeping, that may also be linked between obesity and chronic kidney disease. And sleep apnea is most common in those with chronic kidney disease compared with the general population. If you have dry and itchy skin can be a sign of mineral and bone disease that often accompanies advanced kidney disease. If you feel the need to urinate more often than normal, when the kidneys filter are damaged, it can cause an increase of the urge of urinate. Sometimes it can also be a sign of urinary infection or enlarged prostate in men. If you see blood in your urine, blood in the urine can be indicated of tumors, kidney stones, or an infection. If your urine is foamy, excessive bubbles in the urine, especially those that require you to flush several times before it goes away, indicates a high protein in the urine, which is called creatinine. I'll go ahead and explain that further on. If you're experiencing persistent puffiness around your eyes due to the fact that your kidneys are leaking a large amount of protein in the urine rather than keeping it in your body, your ankles and feet could get swollen. You have poor appetite, your muscles are cramping. Electrolyte imbalances can result in some impaired kidney function. For example, low calcium levels and poorly controlled phosphorus may contribute to muscle cramping. Early detection and treatment can slow and prevent the progression of kidney disease. So it's very important that we understand the risk factors of developing chronic kidney disease. The risk can be reduced by controlling blood pressure, blood sugar, quitting smoking, regular exercise, maintain a healthy weight, avoiding excess use of pain medication as well. Risk factors for kidney disease include, but are not limited to, knowing your family health history. It is important step in knowing your risk for kidney disease. You are more likely to get kidney disease if someone in your family has it. Your ethnicity, African Americans, Hispanic, Native Americans, and Asian Americans are more likely to develop kidney disease. Doctors and researchers do not know exactly why this happens, but it may be because diabetes and high blood pressure are very common in these groups. Age, being over 60 increases your risk of kidney disease as well. People age 60 and older are all more likely to have diabetes and high blood pressure as well, which are the two leading causes of kidney failure. If you're over 60, ask your doctor how often you should get tested for signs of kidney disease. So as mentioned before, high blood pressure is one of the biggest factors that increases your risk for kidney disease. And it is the #1 cause of kidney failure. Keeping your blood pressure under control can help prevent this disease or help it keep it from getting worse. That's about 1 out of 3 US adults have high blood pressure. And diabetes is the biggest factor that increases your risk for kidney disease. It is the #1 cause of kidney failure. A healthy diet, being active, and medicine can help manage your diabetes and prevent health problems that can lead to kidney disease. More than 34 million people in the US have diabetes, so it's a major health risk factor for kidney disease. So what does diabetes do to the kidneys? As previously mentioned, diabetes is the biggest risk factor for kidney disease. With diabetes, the small blood vessels in the body are injured. When the blood vessels in the kidneys are injured, your kidneys cannot clean your blood properly. Your body will retain more water and salt than it should, which can result in the weight gain and ankle swelling. Diabetes also may cause damage to your nerves in your body. This can cause difficulty emptying your bladder. The pressure resulting from your full bladder can back up and injure your kidneys. Also, if your urine remains in your bladder for a long time, you can develop an infection for rapid growth bacteria in your urine that has a high sugar level. Early detection and treatment can slow and prevent the progression of kidney disease. It is important to get tested for this disease regularly if you are at risk. People with chronic kidney disease may not feel ill or notice any symptoms. The only way to find out for sure if you have chronic kidney disease is through a specific blood and urine test. These tests include measuring of both the creatine levels in the blood and the protein in the urine. And right here, I'm going to go ahead and cover dialysis and kidney transplants are the two treatments available for kidney disease. Dialysis can take the place for some kidney function, and along with medication and proper care can help individuals live longer. Whereas a successful kidney transplant is the closest to a natural kidney function and considered the most effective treatment for kidney failure at the end stage renal disease, offering a chance for a longer, healthier life. Now, here are a few steps, a few simple things you can do to protect your kidneys. Definitely, we want to start with the importance of getting tested. Screening definitely saves lives. Early detection provides you with the best treatment. So ask your doctor for an ACR urine test or a blood test annually if you have diabetes, high blood pressure, or over 60, or definitely if you have a family history of kidney failure. Reduce over-the-counter pain medications may alleviate your aches and pains, but they can harm your kidneys, especially if you already have kidney disease. Reduce your regular use of these medications and never go over the recommended dosage. Cut the processed foods. Processed foods can be significant source of sodium, nitrates, and phosphates, and have been linked to cancer, heart disease, and kidney disease. And one of my favorite ones, which is exercise regularly. Your kidneys like it when you exercise. Exercise will keep your bones, muscles, blood vessels, heart, and kidneys healthy. Getting active for at least 30 minutes a day can help you control your blood pressure, lower your sugar, which is vital for your kidney health. Research has also shown that you can divide these 30 minutes a day of exercise in increments of 3. You can do 10 minutes of exercise in the morning, 10 in the afternoon, and 10 in the evening. So it's definitely doable. And again, as I mentioned before, manage and control your blood pressure and diabetes. High blood pressure and diabetes are the leading cause of kidney disease and kidney failure. Managing your high blood pressure and strict control of blood sugar levels can slow the progression of kidney disease. Speak with your doctor if you're having trouble managing diabetes or your high blood pressure. Here are the take-home points. Healthy eating patterns and physical activity may reduce your chronic kidney disease risk. Lifestyle interventions to prevent diabetes or high blood pressure may prevent or delay your chronic kidney disease onset. Lifestyle modifications are part of the initial treatment intervention for prediabetes, diabetes, high blood pressure, and heart disease, which could significantly reduce your risk of developing chronic kidney disease. Once chronic kidney disease is identified, dietary interventions are a key part of management. So here are a few tips to follow. We definitely have to cover some COVID-19 pandemic managing tips. Your main health goal is to avoid exposure to COVID-19 during these times. So here are a few suggestions that are dealing for individuals who are dealing with chronic diseases or have any other illness. Make sure that you stay in touch with your healthcare team as often as possible, especially if you have new signs and symptoms of illness. Do not skip these appointments. Do not postpone these appointments. Research has shown that the amount of people, the deaths due to diabetes and cancer is increasing due to the COVID-19 pandemic and people avoiding going to the doctor. So make sure that you stay in touch with your healthcare provider at all times. You should first call your doctor's office to see if they have regular office hours or if they're doing phone, Skype, or any types of remote visits. Be sure to wear a mask when you go outside your home. Keep at least 6 feet distance with you and other people. Remember to wash your hands frequently and use hand sanitizer if there are no washing facilities. And of course, avoid touching your eyes, mouth, and nose. And to finish off, I want to go ahead and share some resources, and I definitely want to share this short film, this short YouTube video by the National Kidney Foundation, where you can get a lot more information, and wraps it everything I talked about in 2 minutes.
You know your heart, you know your lungs, and you might even know a bit about your liver. But what do you know about your kidneys? Well, your kidneys do a lot. They remove waste, balance fluids and minerals, control blood pressure, keep bones healthy, regulate hormones, and help make red blood cells. Every day, your kidneys filter 200 liters of blood. When blood enters the kidneys, it is cleaned and returned to the body, while toxins and waste are removed and turned into urine. Kidney disease can disrupt these vital functions. Kidney disease occurs when the kidneys become injured or damaged, which can cause serious problems such as heart disease and heart attacks, stroke, anemia, nerve damage, weak bones, high blood pressure, and kidney failure. In fact, 1 in 3 American adults is at risk. High blood pressure and diabetes are the 2 leading causes of kidney disease and kidney failure. Some groups are at greater risk for developing kidney disease, including those over 60 and those with a family history of kidney failure. There are things you can do to protect the health of your kidneys. Make sure that you keep your blood pressure and blood sugar under control. Maintain proper weight. If you smoke, quit. Exercise regularly. Avoid excessive pain medicine. Eat less salt and fat, and drink plenty of water. If you are at risk for kidney disease, the National Kidney Foundation recommends 2 simple tests every year: an albumin to creatinine ratio, or ACR test, which can identify a protein in the urine called albumin. This is often the first sign of kidney damage. A simple blood test for creatinine can also be used to estimate your glomerular filtration rate, or GFR. GFR can tell you how well your kidneys are filtering and if any damage has occurred. If you find it early, you can slow or stop kidney disease from getting worse. So get to know your kidneys by contacting the National Kidney Foundation, the leading organization in the U.S. dedicated to the awareness, prevention, and treatment of kidney disease. Visit kidney.org or call us toll-free at 855-NKF-CARES. That's 855-653-2273.
And here are additional online resources where you could get more information. As I mentioned before, the National Kidney Foundation is a wonderful resource where you can find a lot of information in addition to information on diabetes. The CDC is also a great resource, and it'll explain a little bit more in detail the relationship between kidney disease and diabetes and how to reduce your risk of developing these chronic diseases. So thank you so much again for having me. Be here. I'm more than happy to answer any questions.
Awesome. Thank you. Thank you. So as she mentioned before, this is our Q&A section. I know we have one question in the chat, and before I go to that one, there was one comment in the Q&A section. She's like, yes, exercise is the best. Water aerobics is the best for our diabetic clients. So thank you so much for sharing that comment. And sorry, technical difficulties. The question that we have on the floor is, what is the effect of ALS on kidney disease?
I am not, that is a very good question. You definitely want to ask your doctor. I have not heard any relationship between those two from my understanding. So feel free to ask your doctor for more information of the relationship of ACL and kidney disease.
Awesome. Thank you. Thank you. So we have, for those of you who may be on our email list, you probably saw an email that went out that said, that gave you guys the opportunity to submit questions. I realized that my camera's off. Hello. That gives you guys the opportunity to submit questions. So we have a few, so we're going to answer those right now. So the first question is, I'm trying to follow a plant-based diet for my heart and have been told that it would be good for diabetes as well. I'm having trouble balancing the carbs. My blood sugars are higher since trying this way of eating. Any suggestions?
Yes, I actually love that question. I think it's definitely one of the hardest lifestyle changes that you have to make, right? Going from, a family where we love eating meat and chicken and turkey. It's always our main entree. So appreciating a plant-based diet is really difficult, but I will tell you that it is fun once you get the hang of it. My number one suggestion is enjoy and give beans the most credit, as much credit as possible, making it one of the main entrees of your plate. So if you go to the market, the first thing you want to do is actually explore all the bean aisle. So one of the my favorite stores to go to is Sprouts, and you want to explore different recipes. I think a lot of the times is that since we have put chicken and meat in such high pedestal, is that once we remove it from our diets, it's very hard to find a replacement because our choices, depending on your culture, is very narrow. So little background of me, I'm Central American. All we eat is black beans. Now, when I'm trying to avoid eating chicken and meat every day, I got to go ahead and look outside of what I'm used to eating. So my suggestion is explore and try a variety of different beans, different ways. You got garbanzo beans, you could have it in hummus, you could have it whole. You definitely want to look outside your culture when it comes to food. But definitely don't make it a burden rather than a fun journey. So look at new recipes, experiment with outside recipes outside your culture. And again, for me, beans are my go-to. I got lentils, you got black beans, you got pinto beans, you got kidney beans. Use that as a source of protein and appreciate plant-based proteins, and your diet will go ahead and balance out, and you'll reduce your carb intake with that.
Mm-hmm, mm-hmm. Yeah, I definitely agree on the beans. Beans are actually really good. When I was younger, I wasn't a fan, but as I got older, I'm like, wow, I don't know if y'all had a chance to just look in the bean aisle at the grocery store. There's a lot of different beans. I was like, wow, okay. And you can get really creative with seasonings too. It's sometimes you don't even realize that there's no meat in the dish because the seasonings are so good. So I definitely agree. It's make it a fun and creative journey when you are talking about nutrition. So we have a couple more questions in the Q&A. One of them, it says, you mentioned water aerobics. What about just swimming laps?
I did mention water aerobics. I've never done water aerobics, but that seems extremely fun, especially if you're a diabetic or if you're starting off with exercise, right? It alleviates a lot of the weight and the movement of your body. But what was the other suggestion? What
about just swimming laps?
Swimming laps, that's also great too. I mean, swimming, just moving, being active. And honestly, one of the best exercises to start off is in water, because you'll be surprised of how much you're actually doing compared to how you're feeling while you're doing it. So laps is also great. Wonderful exercise.
Mm-hmm. Awesome.
And it's also good to change it up, right? Where we have the mindset of you have to run, go to the gym and lift weights. But in reality, there's a lot of different things you could do for physical activity.
Mm-hmm. Mm-hmm. Sometimes, when you say exercise, even for me, it's a little scary. It's oh, I don't want a gym membership. I don't want to go. But like you said, there's a lot of different things that you can do being physically active, because there's a difference between the two. Okay, next question. Is there a chart to help us decode the test or know if the values are not as good as they should be, so we can get an intervention?
You definitely want to speak to your doctor when it comes to any results, any screenings that you're doing. You don't want to decode your own results, figure out what you have. If you have any questions, speak to your doctor. And again, also, if you don't feel comfortable asking your doctor questions, feel free to ask for a second opinion.
Mm-hmm. Awesome. Thank you. Next, when would you start using a glucose monitor if your A1C has been going up? if the doctor says to watch your sugar, what would that mean if you don't have a monitor?
Again, you have to speak to your doctor. Only your doctor could tell you what you need to use in order for you to manage your diabetes.
Thank you. Thank you. We have another one in the chat. So verbatim, this is what the chat says. Because of a paralyzed vocal cord, I've been eating every vegetable with mashed cauliflower. Eat to chew and swallow. I think it says easy to chew and swallow. Well, maybe this is not a question, this is a comment. But that's good to know from that participant that you've been eating vegetables with mashed cauliflower, and I'm glad that it's easy for you to chew and swallow. We have a few more questions. I think we have time for a few more. Let me know, timekeeper, if we're okay on time. But it says, I have heard that there is a salt that is better than table salt. Which one is it?
When it comes to salt and sugar, there's going to be so many different over-the-counters. The difference between salt is that some have minerals, some don't. In general, the body will process it the same. It doesn't, just because some have minerals doesn't make it better. If doctors suggest that you reduce your sodium intake to help you manage your chronic diseases, it doesn't really matter which one you consume. The best thing I could suggest is you definitely want to season your own food. So if you do have salt, you know exactly how much you're using when you're preparing your own food versus the sodium that is in processed foods. Okay, so that's one of the things that I would focus more on is preparing your own food, knowing how much you're seasoning with your own salt versus consuming processed foods.
Okay, that's good advice. And along the lines of salt, is there a salt brand that you recommend?
A salt brand, I'm always an advocate for eating healthy on a budget. So I don't have a brand. I am store brand. Honestly, that is me coming from what I use at home. Again, the best thing you can do is avoid high consumption of sodium. And again, eating healthy on a budget is my thing. So I use store brand.
Take the labels off of both the store brand. It's the same thing. That's
exactly.
Whatever you can afford. That's awesome. Let's see. Are there any teas we should be aware of that could affect sugar levels and kidneys? That's a good question.
That's a very good question. I am not sure. I have not done any research on teas. That's something that I'm going to look into now moving forward. And to be honest, I'm not a tea drinker as well, so I can't give you any suggestions on that.
Are there any supplements that can help my kidneys be healthy?
Water. I think we don't give water enough credit. We did mention, and in the presentation, kidneys are your filter, so you definitely want to consume as much water as possible to help your body and your kidneys do its job.
That's actually good to know because this is a little story time, but my dad, he had kidney issues when I was really young, and he had to get a kidney transplant. And so once he got the transplant, he started drinking a lot of water, and I never understood why. I'm like, why are you drinking so much water? He's like, it's for my kidneys. I was like, I don't understand until I got older. So when you said water, I was like, oh yeah, that's why my dad did it. So thank you for doing that. So do we need to detoxify our kidneys? If yes, what do you recommend?
Detoxifying your kidneys. Again, one of the suggestions that I heard, and I'm always going to fall back, is exercise, maintain a healthy diet. I'm not an advocate on detoxifying or in a diet. Why? Because we can maintain that in the long run, right? So if you detox or if you do a juice cleanse or you get in a diet, what's going to happen? You're going to fall off the wagon, right? Diets are meant to be broken. So my biggest suggestion is work on making lifestyle modifications that you can maintain in the long run. So you definitely want to make sure you drink a lot of water, keep a healthy diet, and you'll keep your kidneys strong.
Mm-hmm. And diets always change. In the last 5 years, it's like, this is the new thing. This is the new thing. I'm like, you can't keep up. So like you said, the best thing, the most easy thing that you can keep up with is just changing your overall lifestyle.
Exactly.
So on that note, as far as lifestyle change, if I have kidney damage, are there any exercises I should avoid?
You definitely want to talk to your doctor about that. Every person is different. Someone could have kidney damage and do every exercise in the book because they are fitness gurus versus someone who has never really done exercise and is starting off an exercise routine. So you definitely want to speak to your doctor, and you also want to listen to your body as well. So if you feel exercise shouldn't feel uncomfortable, okay? Exercise should feel great. Yes, you might feel a little, out of breath, but it shouldn't cause any pain, and it shouldn't make you feel uncomfortable while doing it. That's why we have a lot of different modifications. So everyone has a start level.
Mm-hmm, mm-hmm. Awesome. Thank you. We have a couple more questions. And again, to the participants out there, if you have any questions or, you have any comments, we have a couple comments in the chat before I go to the question. It says, due to my condition, I've learned to find an additive to drink water. I know the importance of drinking plenty of water. That's so awesome. Stay on that path, and you like Miss Katie said, you'll be golden for your kidneys. Okay, next question. Does juicing affect my kidneys? Is that something good? Which vegetables should I include in my juice? That's a 3-part question. So
Okay.
let me know if I need to.
Yeah, I might have to go back. I don't see it on here. So, juicing. I'm not sure what juicing has an effect on your kidney directly. I will say I'm not a huge fan of juicing. Just because you are eliminating a lot of the nutrients and the fiber when you're juicing from all the fruits and vegetables. So I'm more of a big advocate of, either eating your fruits and vegetables or making them into smoothies so you keep all the nutrients and the fiber, okay? I will suggest you add lots of greens. So I did remember the second question, which is which vegetable should I add? Whether you're juicing or making them into smoothies, I want to say the greener the vegetable, the more nutrient dense. So, add some kale, spinach, add a lot of greens into your juice.
Mm-hmm. Cool. Awesome. Well, do you have any last recommendations or suggestions or any last words for our audience today, Miss Katie?
Yeah, I just want to finish up by saying again, don't focus on making small, big changes that you can maintain. Focus on making small changes that you could keep in the long run. Again, exercising should be fun. I know it's hard to start exercising, but once you start a routine, you'll know that it actually gives you more energy. So we got to break those barriers, right? Break those barriers that we don't have time, that we don't, that we're too tired. Because in reality is you got to prioritize your needs for your health. And you'll soon realize that once you start eating healthy and exercising, you will actually have more energy, you'll sleep better, and you will be able to reduce your risk of these chronic diseases or maintain good health if already diagnosed.
Oh, awesome. Those are wonderful last words. And thank you so much for not only presenting, but answering your questions and sharing your knowledge with us. We are definitely grateful that we got to have you present tonight.
Thank you for having me.
Yeah, no problem. This is awesome. So as far as the attendees, we will take a short break, a short 10-minute break. This is going to be the opportunity for you to stretch, grab some water, or if you like where you're at, that's totally fine. We're going to have a slideshow that'll show the resources within the city of Riverside. And let's say, for example, it's like, oh no, I'm going to miss the slideshow if I step out. That's okay. Don't worry. We are going to be sending out the resource slideshow once the seminar is over. And after the break, we're going to have Dr. Mark Basel, who will be talking about the relationship between nerve damage and diabetes. So yes, we will see you back in 10 minutes.
Okay.
All right, so for those of you who are close by, now is the time to start settling in, get used to everything, and look at the last couple slides for the resources. We're going to be getting started quite soon. So now's the time to, get your last minute snacks, get your last minute water. I refilled on mine. And again, just as a reminder, if you didn't get a chance to see all of the slides, this resource slide or these resource slides will be sent to you after the seminar. All right. So I hope everyone had a really nice break and took advantage of this resource slideshow. I know I did. I was like, oh, okay, IHP, okay, Aerobics. So thank you again for those organizations who allowed us to share your resources. So, and like I mentioned before, for those of you who are just tuning in case you missed the resource slideshow, after the seminar is over, we will send an email with the list of resources. So our next presenter is going to be Dr. Mark Basel. And let me tell you a little bit about him. Mark Basel graduated as a physical therapist from Loma Linda University in 1989, and then moved to Northern California, where he worked as a supervisor of physical therapy services for Amador Physical Therapy for 17 years. When he met his wife, Rochelle, he moved to South Carolina and became a director of First Physical Therapy, where he discovered intraneural facilitation. With this discovery, he started the first manual therapy-based treatment program for patients with chronic nerve pain conditions, including peripheral neuropathy. Mark and his wife joined Loma Linda University Health in 2011 and started intraneural facilitation treatment at East Campus Outpatient Rehabilitation. While at East Campus, he graduated from Loma Linda with his doctorate of physical therapy in 2013, and in 2017 became the assistant clinical professor for research at Loma Linda University School of Allied Health and clinical director of Loma Linda University Health Neuropathic Therapy Center, which is a center dedicated to researching and treating neuropathic conditions. Mark has treated and seen improvement in thousands of patients with neuropathic symptoms and started a physical therapist training program for the treatment of individuals of neuropathic symptoms. In addition to treating nerve pain conditions, his passions include his family, his faith, the saxophone, the 49ers, and playing basketball. So welcome, Dr. Basel, and the floor is yours.
Thank you so much, and I appreciate the opportunity to share a little bit about my experience working with patients or individuals that are suffering from peripheral neuropathy. And of course, many individuals have diabetes that I've had a chance to work with. So I'm going to share my screen here, and that's okay. Let's see. Yeah, let me see. So I just want to just kind of mention how relevant I feel this topic is for anybody that has diabetes and is suffering, or maybe is not even suffering. But if whoever has this diagnosis or has diabetes needs to strongly consider how I'm going to prevent getting diabetic neuropathy, and what strategies, what lifestyle strategies I need to do to not get this disease. And then the second thing is If I do get it, what do I do? And I think it's exciting to share some of what we're doing now as a profession to help individuals that are suffering with diabetic neuropathy. It's hard to look at the management of a condition and to look at it from a day in, day out planning. I'm going to eat, I'm going to exercise, I'm going to drink water, I'm going to do whatever it takes to not get diabetic neuropathy. And so, what's going to keep you motivated? And so the first question I'd like to ask is, what is your mission or purpose? For many of us, we have people that look up to us, and they look at us as a role model, as a mentor. They don't necessarily look at us as individuals that are suffering from a condition or have diabetes, but they just need guidance. And maybe you have someone like that in your life. Or there could be someone that you love and you want to live long and have a high quality of life. So maybe that's your purpose what are your unique talents? What do you bring? Is it what character qualities, what gifts and skills do you have? And we all have something. And so I think it's for our good, but also for our mission, for those around us, to look and say, I'm going to take on diabetes, and I'm going to do what it takes to not get diabetic neuropathy and to treat it if I do have this problem. So I would encourage you to look at your mission, look around you, look at your talents, and say, hey, I'm going to go ahead and I'm going to fight this thing because you're very special and you're unique. And so with that, we can go on to our next thing here. How does diabetes cause peripheral neuropathy? So it's complex, but essentially you have a lot of sugar, and it ends up reacting with very small blood vessels, and then the blood vessels are in charge of bringing oxygen to nerves, unfortunately, the sugar reacts and it's absorbed into these little blood vessels. And then when it's absorbed, they close up. There's structural changes that occur. And so now you have essentially a log jam. Blood is no longer going through these blood vessels. And then oxygen, which fuels your nerve and gets it working, is not then is not then brought to the nerve as well. And then you get swelling and it becomes a problem. So swelling occurs with blood loss to the nerve. And then you have fibers inside the nerve. We'll talk a little bit about this later also. It's called the nervi nervorum, and they give you all the funny feelings, the numbness, the tingling. And we'll talk about the role of that, because I think that if you have diabetes and you know someone who is suffering with it, they will probably have funny feelings that they wish they did not have. It could be for cramping, it could be numbness, it could be tingling, it could be burning, it could be a heaviness, it could be an aching feeling. It could be electric shocks, knife-like pain. Sometimes individuals don't have any pain. Other times their pain is constant. Many of the patients, they have more severe symptoms during certain parts of the day or at night. Many of our patients also have other associated problems as well. But anyway, so when this occurs, when these different signals occur, the numbness, tingling, and so forth, then what is that causes that? What are you really feeling? I think it's important to know that. And I have some patients that even come to me and they say, well, I feel numb, but I can still feel pain. How does that work? So we'll unpack that a little bit. The nerve will eventually lose the ability to regulate circulation, feel, and control muscles. And that's just the blood isn't getting to the nerve. The nerve doesn't have energy because blood brings the energy. And so the nerve can't do what it's supposed to do. And then it has these sensors that will let you know that something needs to change. And these nerve trunks can be painful if you stretch them or touch them, or even when you rest. Okay. Signs of peripheral neuropathy due to diabetes. So, I put this in. This is sort of like ants on the feet there. You get these funny feelings and numbness, tingling, burning, electric shocks, and pain. If you're starting to get any part of that, or even if you don't have diabetes, if you start to get some of those feelings, it's almost always associated with a lack of circulation to the nerves, and that causes nerve damage, and that is what peripheral neuropathy is the nerve is in the process of being damaged. Okay. So the sensors in your nerves will let you know that you have problem with your circulation. And this is it's a complex slide. And if you can ignore most of the stuff, the main thing is this wire right here. This wire is like the wires, and you actually have wires inside your nerve. And this is a sensor. And if the water gets low, the sensor will let the individual know that, hey, the water's low and we need to make some changes. It's the same with your nerves. And so you have sensors within the nerve that will let you know that you have changes in circulation. You now have inflammatory markers in your nerve trunk. And so these sensors are the ones responsible for your feelings, whether it's pain or numbness or tingling. Now, these feelings seem to coincide with different parts of your circulation. For instance, if you have tingling, many times it's an indicator that your circulation is kind of coming and going. It's more intermittent within the nerve trunk. If it's numb, that generally indicates a lot of congestion within the nerve trunk. So anyway, and that's just a few of the examples. The electric feeling often has to do with stress that's associated with the axon itself. So, but anyway, you have sensors in your nerves, and they're the ones that give you the funny feelings and if something's up. And so diabetes creates one problem, and then these sensors sense that the problem's going on, and then they let you know it. And then, you have to figure out, how to get rid of these feelings and how to improve the circulation and the overall health of the nerve. Okay, so let's back up a little bit. Let's go to screening. Your feet feel pretty good, but you don't want to have any problems as a result of neuropathy. So it's important to screen. Why do you need to screen? Well, if you're not feeling your feet, or if you're not feeling as well as you could have an area of skin breakdown. And the skin breakdown and you would know it. You couldn't feel the pain because those nerves aren't getting the blood flow they need. And so you start getting maybe some red areas or sore areas, and you'll need to take care of that because those can progress and create what's called an ulceration or a wound. I'll show you an example in just a minute. So one way you can screen is you can just have a mirror. You hold it up to your feet, and then you can look for wounds. Now, maybe you would start using the mirror if you're having trouble feeling hot or cold sensations. That is pretty early on with diabetic neuropathy, and so you can use the mirror to look at the bottom of your feet. You can have someone else look at your feet, and that's important. So that would be easy, and you may not be able to reach down and look at the mirror. So you could have someone you love, or maybe a associate or somebody that is around you, and say, hey, can you just take a minute to tell me how my feet look. It's not an issue. You can also schedule regular visits for foot care with a podiatrist. The recommendation is at least yearly. I think most individuals that are struggling with their feet, with sensation and pain, certainly see a podiatrist, even on a quarterly basis, once every 3 or 4 months. And then the podiatrist may say, hey, you need to come more often. So anyway, that's a wonderful resource to help you with your foot care. You can also eyeball your feet for for color changes. If you have redness, like in this picture, that's a concern. If you have bluing, that's a concern. So, and the concern should lead you to see your doctor, your general practitioner, who can help you to get tested and help to establish a plan for you as far as your circulation, your feet, and your neuropathy. So you can also examine your feet for increased sensitivity. Here's the ulcerations that can occur if you don't do the regular screening and you lose sensation of your foot, and then something pokes your foot, it creates a sore and you don't know it, and you walk and so forth. So this is a very real issue. In more severe cases, this can lead to a progressive ischemia, or I wouldn't say ischemia, it's a progressive expansion of the wound. It gets bigger, and so then you have to go to the hospital, and then they address it, and they'll have to take care of it. In a worser case scenario, if the circulation is poor and this starts, then in a number of cases, it's infrequent, but it happens. You can have an amputation. So anyway, that is can all be prevented by screening and looking at your feet on a daily, or certainly on even every 2 or 3 days. Make sure that your feet are good. I would do it daily. All right, I got this, and this is actually a recommendation on the way that you can test your foot for neuropathy and for sensation. You can use a small filament, and you can touch your foot to see if you can feel it or not. So it's something that there are screening tools out there. I think that this is something, and after I'm looking at it now, I think this is something more that a medical provider would do with you. And I think that probably using the mirror and having people regularly examine your feet would be the best bet. So I would recommend, and you really, if you're having some, or if you've been diagnosed with neuropathy, or you're having some sensory problems and feeling hot or cold, then you definitely need to start screening your feet regularly. All right. So, but let's talk a little more about prevention of diabetic neuropathy. So, the prevention of diabetic neuropathy, the very first thing that you have to consider is your blood sugar, and make sure that you're following up with your physician. There's patients that come into my clinic, they say, I'm doing great with my blood sugar. I still have neuropathy, but I'm doing great with my blood sugar. And there is a reason for that, that you can have, and we'll get into that in just a minute, as far as why your blood sugar can be okay, but you have neuropathy. However, it makes it much easier to treat somebody if they have their blood sugar under control. It's one of the first things I ask my patients is your A1C, which is a measure of your of a range of your blood sugar, sort of an average range over 3 months. Anyway, they look at your A1C, and the recommendation is that it needs to be less than 7 if you have diabetes. In general, people look at their blood sugars, or it's recommended for individuals that have diabetes to also monitor your blood sugar, and the recommended range is 70 to 130. And this was discussed earlier today. That's something you definitely would want to discuss and coordinate with your physician, and how about the testing, and that's extremely important that that's medically managed. Okay, so blood sugar is the first thing. Now, their lifestyle is very important, especially with type 2 diabetes and type 1 diabetes. It's also helpful. So prevention of neuropathy, as far as lifestyle is concerned, exercise, 30 minutes of exercise. This, again, is something that it would be good to have your physician aware of if you're just now thinking about, after a period of inactivity, of starting to exercise. Maybe you enjoy walking outdoors, and walking is great exercise, brisk walking. And so you can go outside and make sure that your balance is okay. You have appropriate support if you need a walking stick or something. But walking is excellent exercise. It doesn't have to be vigorous running, and you can increase the strenuousness of your exercise as you are feeling like you're able to, and the doctor says it's okay. Fresh air is important, and you want as much oxygen in your bloodstream, so being outside and will help invigorate your body and your mind. We encourage you to also drink plenty of water. Water is extremely important to help maintain the pressure in your blood, and so that if you have a lot of water in your blood, then you're able to push your blood easier into your nerves. And so if you can have at least 8 to 10 glasses of water a day, that would be helpful for neuropathy. Okay, mental health. Mental health is important. Why? Because if you're under stress, then you can have increased tone in your sympathetic system, which closes down your circulation. And that stress can, and so then you're going to have smaller spaces for the circulation to flow into your nerves. So to have a positive, healthy, happy outlook is going to expand your blood vessels, and you're going to have more blood flowing into your nerves. And that's just from looking at from a neuropathy prevention perspective. There's many wonderful reasons to have your mental health cared for, and some suggestions here are hobbies, having people that you love, and then having a mission. I feel like spirituality is important as well, and so all these things you can consider, and lifestyle and where you are is going to go a long ways towards prevention and managing neuropathy. And here's some suggestions. Okay, now there's prevention of neuropathy autoimmune. What we're finding in my clinic is that there is an autoimmune component to diabetic neuropathy. Now, this is still preliminary research, but I'm going to share with you a little bit of our findings. Our findings seem to indicate that it's not only your blood sugars that are contributing to diabetic neuropathy, and this may be new information for you, that there seems to be a genetic link to an intolerance of certain foods that both raises your A1C and creates another layer of inflammation that shuts down your circulation and damages your nerves. In essence, there's foods that may not increase your A1C or your blood sugars, but these foods damage on their own, and they do that by aggravating your immune system. So this is not hyperglycemia creating neuropathy, but there are studies that indicate that foods such as gluten, if you have diabetes, will help. If you go on a gluten-free diet, it will help not only manage your A1C, but it's also associated with diabetic neuropathy. And if you eliminate gluten from your diet, it'll help out with both the neuropathic pain or nerve damage as well as your A1C. So it's difficult to measure in a test. However, there is research that is showing this, and we're seeing this in our clinic as well. So what would that mean? That would mean this, that there may actually be two components to peripheral neuropathy for individuals or nerve damage, progressive nerve damage. The first one, and this is from a food perspective, the first one is unknown autoimmune food consumption. In other words, you don't know what foods your immune system doesn't like, and the most common one is going to be gluten or wheat, plus poorly controlled blood sugars equals eventual peripheral neuropathy. And so at our clinic, we have to look at both. All right, common foods which your immune system reacts to and creates neuropathy. Wheat or gluten, and that's in bread products. Dairy is another one, and that's with cheese and cow's milk and different things. Ice cream, chicken, peanuts, cashews, and beef. So those are some common ones that we will test for our clinic, and we test using ultrasound, and that's for another discussion. All right, treating existing peripheral neuropathy due to diabetes. Okay, so you have neuropathy, how do you treat it? And we've gone over some of this, and I'll provide this as a summary. Notify your physician, however you want to proceed with treating it, your physician needs to be your partner with your treatment plan. Your physician may refer you to, if this is a general physician, may refer you to a neurologist to have you tested for vitamin B deficiency. He may have you tested also with an EMG electromyograph or a nerve conduction study. So, the physician can provide you with some valuable information and can help you help coordinate that also and network with other physicians that can help you with your neuropathy. Make sure your A1C is within normal range and your blood sugars are controlled. And we mentioned that earlier. See a podiatrist. Perform regular self-checks daily for wounds on the feet or for skin breakdown. And then prevention would be also eat non-inflammatory foods, reduce sugars, reduce lifestyle stressors, and that would be what we mentioned earlier about exercise and mental health. So what if I still have nerve pain and I do these things? Okay, so we've gone through these things and you still have nerve pain. This is not uncommon. I still have it. It's not curing the problem. And that's not uncommon. The issue is that once the capillaries close, you don't get circulation to your nerves. It's tough to reopen them. You can't necessarily massage them open. You can't exercise them open entirely. And so, can there be some strategies to funneling enough circulation at a very specific point in your nerve so that can overcome the resistance of these capillaries that are closed and open them up and just spring them open? So if you still have nerve pain, there are some options here that you can still pursue. And here they are. The first one is you want to see a neurologist for testing. We talked about that a little bit. There's a traditional approach that the physician will talk to you about. One is medication management. There's very specific medications that he will suggest for you that help out with nerve pain. And so I would encourage you to follow your doctor's instruction regarding those medications. The next more traditional approach is physical therapy for strengthening, stretching, and they'll, if you need some sort of orthotic devices, they may help coordinate a referral to a podiatrist or to a orthotist. There's also some non-traditional management. And again, this should be coordinated with your physician. One is acupuncture. Acupuncture has some evidence that it can help when someone is still having nerve pain, their A1C is under control, and what do I do now? And so acupuncture does have evidence that it's impactful. Now, when you do some of these non-traditional methods, the end goal you should understand what the end goal is, and so talk to the practitioner. And when you talk to the practitioner, he will help you to look at it. And for instance, he'll tell you, well, this is going to help you manage your symptoms, or maybe it can help cure your symptoms. And so, you need to be aware of what their goals are for you if you go outside of traditional medical management. The Neuropathic Therapy Center is what I'm involved with, and we use internal facilitation. They have some electrical stem units as well. Okay, so this is this is just a kind of a picture that shows some of the holds and positions we use. We pull on one foot, which stretches the nerve and the artery. This being the nerve, that being the artery, it stretches connecting vessels and circulation goes into the nerve. That would happen at this foot. And then with intraneural facilitation, then we can stretch out your sciatic nerve by stretching out your hamstring, and that pressurized flow will then go into your sciatic nerve there. And so we have a system that uses these principles. And so we're excited to be able to use this with our patients. And we we're just concluding 2 studies, which we're excited to publish soon, that involve improved balance, decreased pain, decreased paresthesias that's been associated with individuals with diabetic neuropathy after a series of sessions at our clinic. Okay, best practice non-traditional treatment strategies. Okay, now this is non-traditional. We mean you're going outside of you're already having it managed by medicine, and you're looking for other options. First of all, make sure your blood sugars are balanced. Discuss gluten-free, dairy-free diet with your physician. This is something that I personally feel is overlooked when it comes to diabetic neuropathy. It's something that you should discuss. Microvascular intervention pushes blood through capillary beds next to nerves. There's several options for that, and this needs to be discussed with your physician. TENS unit, acupuncture, there's lasers, cold laser, and then internal facilitation, which we use in my clinic. There are some things I would like to caution you on. First of all, you need to watch your expense of homeopathic care. It's not traditionally covered by if you're going outside of traditional care, it can be very expensive. And so you need to watch the expense of the homeopathic care and do some research if you're going into, if you want to spend some money on a TENS unit or machine, or you're going to a clinic that treats for neuropathy and advertises as such. Just be very careful as far as the expense is concerned. And I won't get into that too much. Do your homework and look at their success rates, see what evidence they have for what they're using to treat. And so anyway, that would be a recommendation, that you need to be careful that you don't blindly throw money at intervention that doesn't have a lot of evidence or isn't working towards gaining evidence. Ensure your physician is aware of any medical or alternative therapy you are pursuing. I want to thank everybody for attending attending and listening to this presentation, and thank you for the opportunity to share about something I feel I am passionate about, and that's treating individuals with neuropathy. And there's about 50 to 70% of individuals with diabetes have neuropathy at some point, and so it's something that hopefully we can, as a medical community, can continue to improve our messaging, continue to look at the best ways we can support individuals with diabetes in regards to this problem. Thank you very much.
Awesome. Thank you so much, Dr. Basel. I learned a lot from your presentation, and I really like that that picture. Is that you or is that a stock photo?
Stock photo.
Oh, okay. I was like, wow, okay. It's still just as good. So just like the first presenter, now is the time for the Q&A. We have a few on deck here, and then we have a few that were submitted beforehand. So we're going to go ahead and get right into those questions. And if you guys have any other questions as he's answering them, feel free to put them in the Q&A or the chat box as well. The first question, this is in regards to when you're talking about it's good to drink at least 8 to 10 glasses of water per day. A question is, what size should the glass be of water?
What I've seen has been 8 ounces. As far as the literature is concerned, and I'll be honest, it could have changed. The values could have changed. I think that in certain patient populations, they recommend more. And then with the kidney problems or kidney disease problems, they have more specific recommendations, which I believe is less. So, but in general, it's 8 to 10 8-ounce glasses.
Okay, thank you. Next question. Can you name some of the non-inflammatory foods?
Are we talking non-inflammatory? Is that the question, or inflammatory foods?
Non-inflammatory.
Non-inflammatory foods. We've discussed a plant-based diet. Vegetables are an easy one, and so if you look at that and beans, legumes, some of the same things we discussed earlier are going to be in play there. Obviously, you'd have to be careful with red meats. You'd have to be careful. It's almost easier to say the foods that are inflammatory than everything else you can look at. But I feel like Fruits are good, but again, you're going to need to look at how that impacts your blood sugar with fruit. So berries are very good. Strawberries, blueberries, raspberries. So those are not inflammatory.
Nice. I do like me a good blueberry. Next question. Is there a difference is there a difference if neuropathy is coming from my spine instead of from diabetes, which I've been told I have neuropathy in both feet going up my legs and also fingers?
Okay, so that's a good question. All right. First of all, it's not likely that you have it would be a broad-based disc bulge or something, or degenerative changes that would create radiating pain throughout your body in multiple extremities, 2 or 3 extremities. So in most cases, individuals with pain in multiple extremities, you're looking at a metabolic or autoimmune cause. In other words, I had blood sugar problems, or I have an autoimmune problem, or both. If your blood sugar is under control, then we start to need to look down the autoimmune way, and that would be certain foods that would also trigger neuropathic changes. There's also something there's different types of neuropathy that's associated with diabetes. One is autonomic neuropathy, and that also is individuals that have tingling, numbness, funny feelings all over your arms and legs. And you also have a tendency to get lightheaded and dizzy and so forth. So anyway, my suggestion to you is to, first of all, make sure your blood sugars are under control. And then second thing is, check with your physician, see if you can try some low inflammatory dietary changes. And then, see what options are there for you to help with the paresthesias that you're getting outside of medication management. And we suggested a few here.
Awesome, thank you. And from that same participant, they mentioned that was very helpful. Look, I just got a whole bunch of questions. Okay. Was there a book you showed earlier?
No book. No, I didn't show a book earlier. Are they interested, or maybe the question is, are they interested in literature regarding diabetic neuropathy? Or there's a lot of good resources online. There's also, if you just type in neuropathy, peripheral neuropathy, there's a website from the Foundation of Peripheral Neuropathy that has a lot of good information. Our website, the Neuropathic Therapy Center, we have some information, some good information in a blog regarding peripheral neuropathy management. There's other sites. Mayo has a lot of really good information as well on treating peripheral neuropathy.
Nice. And then we got some clarification from that participant. Said, I thought it said anti-inflammatory. It looked like a book.
Okay.
You did provide a lot of good literature that they can look into if they want to, look further into neuropathy. So thank you for that.
Sure.
Another question. Do you think the Rebuilder TENS, I'm not sure if that's acronym or TENS, unit can help diabetic neuropathy for my husband? I've used one for neuropathy caused by spinal cord nerve damage.
So, okay, so the Rebuilder I'm familiar with. You do want to make sure that the physician, his doctor's okay, it's on board. It has a mechanism, it's been around for a while. And I believe that it mimics the nerve's natural conductivity, which actually promotes circulation within the nerve fascicle. So it may be an effective management tool, and that's certainly something you can check with this physician. Obviously, now some of the older Rebuilders, I don't think the new ones have it, but the older ones you actually had to put your feet in water and do different things. So that's the one you definitely want to have the physician get on board that his feet are okay and it's safe for him to use the machine. So.
Awesome. Thank you. We have another question coming in live. Can some of the suggestions in therapy help if you have general neuropathy due to extremity injury and surgery?
You're going to have complicating factors. So anytime you have surgery that overlays an autoimmune problem or a metabolic problem, you have at one point, or you do now have blood sugars that are largely under control. Or autoimmune would be food that is actively damaging your through the immune system, damaging the capillaries. So that's one layer or one cause. Like anything, you can have 2 or 3 different causes. And so if you have an injury, that it's going to be harder to repair the nerve after the injury, because if you injure a joint or whatever, you're injuring nerves as well. So it's going to be more difficult to rehab and treat. So you definitely want to see a neurologist, have them parse it out. Make sure you go to rehab, physical therapy, occupational therapy, but also look at it from multiple perspectives. I mean, there's a traditional perspective, but also look, are you eating the best food? Are you having a low stress lifestyle? Are you trying to find strategies to push circulation into your nerves, in addition to trying to treat your injury or strengthen, stretch around the injury? So anyway, it's a complicated question. Hopefully I helped you out.
Thank you. So it looks like that concludes the live questions. And again, if you guys have any questions that pop up, feel free to put in the Q&A box. Now I'm going to transition to the questions that were, actually a comment that was excellent. Thank you. So that was to you, doctor. But now I'm going to transition to the questions that were previously submitted. So question 1, what type of exercises are helpful to prevent diabetic neuropathy?
Okay, so I would say, first of all, I recommend if you're going to exercise, you need to do it in a cool environment. So I would not get overheated when you exercise. I recommend you exercise in the morning and at night. And the exercise, what we found to be the best exercise that brings circulation to nerves, believe it or not, is yoga. And so I would recommend, now yoga there's different levels of yoga and layers of yoga. So whatever you do, you want to make sure you're kind of, you're working with your physician on that one. There's chair yoga and different things, but it's the isometric weights seem to bring some more blood flow to nerves resistance than aggressive, heavy aerobic activities. So now it's good to walk, and that helps your heart and pushes blood around better that way. So I'd recommend you do that, but also consider some trainer to help you, or the physician help coordinate some sort of low intensity weight training program, or if you can't do yoga, the doctor can maybe help guide you with that. So anyway.
Yes, I'm a huge fan of yoga. It's so nice and relaxing. It definitely de-stresses you. Next question, is diabetes reversible?
So type 2 diabetes, it seems like people are able to reverse it with lifestyle changes. Type 1 is not. So anyway, but and there's other factors too, other comorbid or associated factors that go into that. And certainly you'll be, and I've had patients come to me and say, I used to have diabetes, but I got it under control. And I think you always have to be mindful. You can't all of a sudden just, do what it takes to reverse it and then just go back to your old life afterwards. I mean, it's something that you're going to have to continue to, engage in a lifestyle of health to keep it at bay. Yeah.
That is a really good point of, once you meet your goal, it doesn't stop there. You have to maintain the goal. That's the hardest part. Yep. Question number 3. I've been tested for diabetes and they state I'm not diabetic, but my sugar tends to go down to 50. So I have to check my sugar levels. I've never had them high, but I do get them low. Am I diabetic?
Hypoglycemia. I think that is certainly a good question for a physician, to someone that is going to be more diagnostician. And I'm a physical therapist, so I'm not a diagnostician. I think I would probably defer to your medical doctor on that one. Yeah.
Okay. Do you recommend diabetic socks?
If they work for you, I mean, just get comfortable. So, people will go to diabetic socks and they're more comfortable. They're not as irritating on their feet. If you're having some sensory problems, you're not feeling your feet, then you're having some issues with skin breakdown. I definitely recommend them.
Mm-hmm. Thank you. How is diabetic neuropathy treated?
So the American Association of Neurology has come up with some guidelines for the treatment of neuropathy, and diabetic neuropathy would fall into that category. And so, but they've recommended medical management primarily, but then also with diabetic neuropathy, it's being treated through lifestyle to make sure that your blood sugars are out of control. We're trying to push the boundaries to that with that recommendation. Now, the hardest issue is this. The hardest issue is that once you have diabetic neuropathy, we need to come up with some strategies to push blood into your nerves or your feet, which is tough because it can actually form sort of a seal once that occurs, and then you get these little sensors that give you all the funny feelings in your feet. So there are some challenges with that. So that's when people start looking outside of traditional care. They have the medication, they do the lifestyle, they still have the paresthesias, the numbness, tingling, burning. So then they start looking at TENS units or laser treatment or acupuncture, and that all, and that's like the next level. And that's where you start talking to your doctor. It's tough to research. It is, and so before we're too hard on some of the non-traditional medication or means of trying to help out people, individuals with diabetes, it's a hard disease to research, and there's so many different factors and variables, and so anyway. But ultimately, I would not settle for an answer from anybody that you're gonna have to live with your pain or your discomfort. You need to push beyond that, and because there are options out there that can help you.
Mm-hmm, mm-hmm. So. And on that note, we have a comment. Buying new shoes is the hardest thing for me because I can't feel if the shoe is pressing. I have to wear them for short periods of time for a few days to make sure there are no pressure points.
That is smart. Someone's being extremely careful with their feet. And
I like that.
That's that screening stuff. You just can't, it's bad enough to have the numbness and tingling, but you start working with the wounds and the ulcerations and skin breakdown, and it's slow healing. Unfortunately, it's that's really smart to and that's probably some good advice to if you get new shoes, to just look at your feet every day or two when you put them on to make sure you're not having skin breakdown.
Thank you for sharing to the participant who shared that. But like the doctor said, that's a very way to be innovative.
Yeah.
Okay, we are going to maybe 2 more questions left. We have 5 more minutes left. So yeah, 2 more questions left. What question was I on? Does everyone who is diabetic get diabetic neuropathy? No,
it's but a high percentage. Yeah. So yeah, it's too high. But it's not. It's something that everybody that has diabetes needs to look at. And I've had some patients that have very mild symptoms, and occasionally I'll get an individual that says, I just don't want to get it. Is there something I can do? And so it's good to see individuals being proactive, and looking for strategies to improve their circulation. It's called microvascular circulation, the circulation in the nerves. So that would be that is something that, but probably about 40, well, it's the research indicates between 40 and 70%. So it's somewhere in there. So you have about, and then if you settle, okay, you have a 1 in 2 chance of getting diabetic neuropathy or peripheral neuropathy due to diabetes. And that's, so you have to be mindful of it.
Thank you. So one last comment I see, for those of you who are on Medicare, a participant mentioned that Medicare allows the podiatrist to visit every 9 weeks to also cut nails.
Oh, okay, there you go. Do that.
Yeah, yeah.
do that. 9 weeks. That sounds good to me.
Yeah, that's good.
Yeah.
And the last question, for people with diabetes, what is the best way to care for the feet?
Well, just care for your body first of all. I think that, make sure you don't, watch your feet. Make sure you don't get injured. Balance is an issue. I didn't talk much about balance today, but balance is an issue. And so, you need to, if you're having sensory problems, watch where you're walking to make sure you don't. People will struggle with uneven surfaces or rocks and dirt and different things. So just be really careful. But how do you care for your feet? I would say the main thing is to do the self-screening, as well as to do the things that help out your circulation in general. Healthy lifestyle, mental health, regular follow-up with physicians, spirituality. Eating right, looking at low inflammatory foods, as well as, making sure you keep your carbs and your sugars under control.
That seems like a pattern for tonight. This overall lifestyle change will, fit your kidneys and, help with the neuropathy.
It's, well, and she alluded to that as far as the nerves and the kidneys. It's the circulation to the nerves is like its own organ. It goes everywhere. So, if you're improving your circulation to your feet or your kidneys, you're also improving it to nerves in your other places as well. So anyway, it's you're right. I think it's we're all saying the same thing. Yeah.
Well, thank you so much. That concludes our Q&A. Thank you to definitely both presenters today. I learned so much, and I'm sure the participants, and we have some comments of saying thank you. I love the information. So the participants loved you guys as well. And thank you for the participants who joined us for tonight at our 11th annual diabetes seminar. And now it is time to learn about how you can win some awesome prizes. So in just a moment, a poll will appear on your screen. It's going to look exactly like the first one, so don't be alarmed. We did that on purpose. It's a pre and post. So once that screen pops up, then feel free to complete the poll and answer the questions to the best of your ability. We definitely, like I mentioned in the beginning of the seminar, we definitely value your feedback, because the purpose of it is for us to continue to improve the diabetes seminar. So I encourage you to fill out the poll for a chance to win some great prizes. So it's not just for our benefit, so we can benefit the diabetes seminar. This is actually the part where you can be entered into the drawing. And again, just like the pre-survey, for those of you who are having or may have technical difficulties with the Zoom poll, or there's multiple people in the room with you, you also have the opportunity to scan the QR code that you see on the screen, so you can answer the questions via SurveyMonkey link. And again, I'm going to read through them, but I'm not going to go as detailed as the pre-survey, because it's the same questions. But please rate your level of knowledge about preventing and managing diabetic neuropathy. Ooh, just kidding. That was question number 4. Question number 1. Please rate the level of knowledge about the relationship between diabetes and kidney disease. Question number 2. Please rate your level of knowledge about preventing and managing diabetic kidney disease. And again, the scale is 1 being not knowledgeable at all, 2, not very knowledgeable, 3, neutral, 4, somewhat knowledgeable, and 5, very knowledgeable. Question number 3. Sorry, the questions got all mixed up. There you go. Question number 3. Please rate your level of knowledge about the relationship between diabetes and neuropathy. Now here's question number 4 again. Please rate the level of knowledge about preventing and managing diabetic neuropathy. And last question. Please rate your level of motivation to incorporate the recommendations on how to prevent or manage diabetes. Oh, and the question number 6. Have you been diagnosed with a chronic disease, for example, heart disease, cancer, stroke, Alzheimer's, diabetes, kidney disease, etc.? Yes or no? So now that we read through the question, question number 7. How many family / friends were you, let me try that again. How many family and or friends were with you participating in the workshop? 0, 1, 2, or 3 or more? I believe those are all the questions. Yes, 7 questions for the post survey. 2 questions more than a pre-survey. So I'm gonna give you guys maybe 1 more minute to finish those. And again, if you're having technical difficulties, feel free to contact tech support, or the link should be in the chat by now for an alternative to how to do the survey. And again, this is a very important part because you'll be entered into a drawing for opportunity drawing for a chance to win a prize. And then in the chat, I see from one of RCHS committee members, if there's specific feedback, like written feedback that you would like to give to us, feel free to put it in the chat. So I'm going to read off those questions. So this way, again, because with this one, you actually have to write out the sentences and it's not just multiple choice. So if you have, after I read the questions, if you have any answers to those questions, feel free to put in the chat. The first one is, in what ways do you plan to incorporate the information from this workshop in your life? So if you plan to incorporate them, now is a chance to let us know how. And the second one, what topics would you like us to cover for next year? And for the participant who mentioned that she didn't get the survey, we have the link to the actual survey for you. Oh, awesome. I see that somebody answered the question. Nice. All right, I'll give you guys, since there's, since this is a little longer than the pre-survey, I will give you guys a couple more minutes as I read through the chat to make sure everyone's okay. What topics, sorry, wrong one. What is the name or website of the second speaker's business? That's for you, Dr. Basel.
Oh.
Put it in the chat.
Okay.
Or if you want to say it, I don't know.
Okay, sure. It's a Neuropathic Therapy Center.
Okay.
Yeah.
Then a comment, I'm going to look into the autoimmune component to neuropathy and try to cut out certain foods. Awesome, thank you.
Very good.
Cool. All right, so I feel like the actual poll is finished. So if we can go ahead and end that poll. Awesome. Another question, I looked them up on Google. Are you with Loma Linda, Dr. Basel?
Yes, I am. Yes.
Cool. Awesome. Cool.
I'll put it in neuropathic.
Okay, cool. So as we end tonight, if you guys have any extra comments, feel free to put in the chat. We're going to save all of all of the chats at the end so we can collect all of the data. But I want to remind you all, if you would like more information about the National Diabetes Prevention Program that we mentioned in the beginning, feel free to call 951-788-3471, and that's our direct office number. And then you can just tell the receptionist that you would like to speak with somebody to give you more information about the National Diabetes Prevention Program. Or you can email one of the lifestyle coaches. Her name is Carla, and her email is Carla, CARLA, @rchf.org, or you can visit rchf.org directly. And then the resource email, just a reminder, will be sent after the seminar is over in case you didn't get a chance to see any of the resources. So that concludes tonight. Again, once again, thank you all for joining us. A special thank you to our guest speakers tonight and the planning committee for helping us make this event possible. We hope that you gained valuable information from our guest speakers. Remember, you can live a healthy, happy life, even with diabetes. And that concludes tonight. So thank you all, and I hope you have a great rest of your Wednesday evening.